Hi guys, welcome to day two, video two, I should say. And for all of those Tampa Bay fans today, congratulations, you now have Tom Brady as your quarterback. I'm sure a lot of Patriots fans woke up this morning feeling a little sad because they're Patriots fans, so I guess that's not going to change. But I wanted to start with a little exciting news or non-coronavirus news before we get going. So today I wanted to discuss one, testing availability, and I'll try to make that specific to Georgia. Two, common symptoms. And three, I'm going to touch very briefly on the NSAIDs and treatment options. So if you do become ill, what are your best treatment or what is being recommended at this time, I should say. So number one, testing is extremely limited in many places, but definitely here in Georgia. I know that as of last week, there was approximately 50 sample tests being done a day. Supposedly this week, we're now up to either 100 or 200, but that information is very, I've heard two different numbers there, 200 being said yesterday by the governor, but however, I've seen reports of 100. And additionally, everything in Georgia is still being confirmed at the CDC, which means that Georgia's running a test, and then those samples are further being confirmed at CDC. So there could be extreme lag time in seeing our numbers. So right now we're seeing approximately a 20-ish jump. So if we're only, and these are results maybe from last week, so 20 or so out of 50 that are coming up positive. So take that as you will. The numbers will probably continue to jump as testing expands. Touching on that part, I do know that in Cobb County they are beginning drive-up testing. However, this is only if you have a letter from the Department of Health stating that you should be tested. Basically, unless you're extremely ill and hospitalized, you're probably not going to get tested in Georgia. And additionally, unless you have confirmed contact, close contact with an individual who has a positive case that has been confirmed, and you might have some high risk, conditions that might make you more susceptible for a severe disease, they'll probably test you then. But it's very unknown exactly what will get you tested. I do know that a lot of hospitals are essentially saying, unless you need to be hospitalized and you have severe symptoms, you're probably not going to be tested at this point because there's such a backlog. I do know that in the state of Georgia, there have been emails sent out to public and private universities, and specifically to microbiologists, asking for reagents that are necessary to conduct these tests. So this includes RNA extraction kits, as well as trying to ascertain the number of thermocyclers, so what we perform the PCR tests would be performed on, as well as skilled individuals. So that being said, other areas of the country are certainly doing their own testing. So I identified what's going on in Georgia right now. And what's happening in, say, University of Washington is I know that they've employed a lot of voluntary graduate students to try to ramp up testing capacity, but obviously you need the tests to be able to run those samples as well. So things are very limited right now. Unless you are extremely ill and you basically need to be admitted to the hospital, you probably aren't going to get a test right now. If you are somebody that thinks you may have been positive at some time and recovered, down the line, there will probably be serology testing, so you can test to see if you've mounted antibodies against the coronavirus. And that might be something that gives people a peace of mind going forward. And I'm talking, in a couple of months, maybe you can see, have I been exposed to this? Is this something that I could be potentially ill with at a later date, or have I already recovered from it? And so those things might be things that become available much further down the line to answer some of your questions if you think you had it, but weren't able to get tested while you were acutely ill. So going into that, I know Audrey specifically asked about, hey, there's allergies. Allergy season is crazy here in Georgia. The pollen literally makes our cars turn yellow, and that's what's happening right now. So of course we've now added not only cold and influenza, but we've got allergies to make it difficult for people to understand if they're actually sick with something like the coronavirus, or if they have some other seasonal issue, either allergy or another infection. And so I really wanted to touch on between allergies and coronavirus. There are some symptoms that seem to be different, and those are the things, and you know your body best, so you know what allergies feel like to you. But one thing that's going to be more common in allergies that is really not being seen in coronavirus, and this also might be true for also things that are seen in the cold, but not seen, so your common cold, I should say, but not in coronavirus, is you're not really going to have itchy, watery eyes. You're not going to have as much of a runny nose or sneezing. So those are things that if you are experiencing those symptoms, they're much more likely to be common cold related or allergies, and extremely rare if pretty much not seen in coronavirus. I know we kind of say the coronavirus starts with some symptoms and then kind of ramps up. What you will have with the coronavirus that's been reported that you might not have with allergies are things like muscle aches and pains. I'm talking full body muscle aches and pains. So things like when you get hit with the flu really bad, feel like you've been hit with a truck. That's the kind of joint pain and things like that that you might experience with coronavirus that you're not going to experience in common cold or allergies. Similarly, you're probably going to get a sore throat. That seems to be kind of one of the top 4 symptoms that people are looking for, is kind of this sore throat. And very rarely, and there has been some reports of gastrointestinal issues, much more rare. So experiencing diarrhea, nausea, or vomiting might also be something that is going to be seen more in coronavirus, but not seen in your allergies or common cold. Obviously, when we talk about flu, there's going to be some overlap as well with some of that. What I wanted to very briefly touch on is the data coming out of China of 55,000 patients. And this is a breakdown of the top symptoms that were found in positive people in China. And this is 55,000. This is something that will change as we get more data. And that's what I really want to caution everybody to understand, is that current information could be changing, and we're getting new information every day. Unfortunately, the more people infected gives us more data points, but that also gives us more information. And so what came out of China, and I want to say to give you guys kind of an idea of how often these symptoms are seen. Number 1, the most common symptom was fever at 87.9%. I've got the numbers here so I can give you the full breakdown. 87.9% experienced a fever. This was the most common symptom. What we consider a fever right now is about anything above 100.4 degrees. It might start as a low-grade fever, but then it might escalate. And obviously, if you're mild or asymptomatic, you might not experience that high of a fever. But that's the number 1 symptom that was seen out of patients in China, out of a cohort of 55,000 patients. And second was a dry cough. So 67.7% experienced dry cough. From my understanding, this is like you're going to feel shortness of breath. You're going to have difficulty not coughing. It might keep you up at night, etc. So if you have a kind of incessant dry cough, that's another sign that points more to coronavirus than influenza or common cold or allergies. Next is only at 38% is fatigue. This is a very general symptom. This covers basically any time you're not feeling well. And sometimes you can't tell if you're tired because of life or because of illness. So that one, I'm sorry, can't give you a little bit more information because I'm sure we always experience fatigue. Next was 33.4% had sputum production, so expelling mucus. And this might be something that might develop later on in infection after you've got more of an inflammation in your lungs and respiratory tract, and your body's trying to expel that. So mucus. So you might start with a dry cough and it might graduate to something a little bit more serious. And that could be signs of things like progressing disease that include pneumonia in the lungs. After that, 18.6% had shortness of breath. I've heard reports here in the United States of individuals stating that they're so short of breath they can barely talk for a few minutes, that walking around their apartment gets them winded. So that's a kind of shortness of breath. And what I really want to focus on here is what the symptoms you're going to be kind of worried about are things that are kind of happening here in your chest: sore throat, tightness in your chest, feeling like you can't take a deep breath, and fever, as well as these other symptoms. So these are things you're not going to typically see in other diseases. And it could be also a sign that your infection is progressing to something more serious as well. Some of the lesser known or lesser experienced symptoms include muscle, joint, and pain at 14%, a sore throat at 13%. So this is something we've talked about as being one of the major symptoms. It might start as a sore throat, but maybe people haven't reported it as much. After that, a 13% headache, 11% chills, only 5% nausea or vomiting, 4.8% nasal congestion. So again, if you're having a lot of nasal issues, it's more likely not coronavirus, it's something else. And lastly, 3.7% diarrhea. So there are different symptoms. And this is out of the the information coming out of China. I know that there's been some differentiation that's occurred in symptoms that have been reported outside of China. So again, the more data we get, we'll have a better understanding of the breakdown of the kind of symptoms. So those are the things you really want to look out for. I know we keep talking about a mild case of this will feel like the flu. And if you've actually had the flu, you know that doesn't feel mild whatsoever. And some people who basically haven't even been hospitalized have still said this felt pretty awful. So even a mild case of this might really get you on your butt. So if it doesn't feel that terrible, either you're very mildly asymptomatic and you don't need to go to hospital, you don't need to see a doctor, or only do those things when you're really experiencing things like shortness of breath, difficulty breathing, extremely high fever. Those are the times it's time to go in, time to contact a physician, try to get a test if possible. So that being said, I know Christy had a question as an RN, so she's actually out in the field, and she had a question about the use of NSAIDs, so things like Advil, ibuprofen, as treatment. So typically in viral infections, a lot of times in these infections, it's not necessarily recommended to use NSAIDs because it's basically an anti-inflammatory and it kind of suppresses your immune system. And a lot of the times what you're experiencing when you're experiencing some of these symptoms is it's your immune system trying to work and fight the virus. And the only problem we get to is when your immune system is getting too overwhelmed and it can't keep up and it's throwing new things at it, trying to fight back from the infection, but is not able to. So a fever actually is in some cases good because viruses don't like being hotter than they need to be. It's not necessarily, doesn't keep their viability, so they can't stay alive as well. They like living in a very specific kind of maximum temperature, and after that they start kind of falling apart. So treating things with high heat like a fever kind of is the body's way of trying to basically, it can survive, but hopefully the virus can't survive. So what happens with anti-inflammatories a lot of times is then it reduces inflammation, but that also reduces your body's immune system to come and try to fight those infections. And if you have like a lung infection and you take an NSAID, it might decrease the ability for your immune system to respond effectively. And you don't want it to be caught behind, essentially. So overnight, what was clarified and said by the WHO is that they are not recommending use of NSAIDs for treatment. You should really just use a pain reliever, fever reducer like acetaminophen or Tylenol if possible. There has been reports out of France and I believe Germany also saying that there seems to be an increase in severity of disease with the treatment of NSAIDs in patients. This has not in any way been definitively proven, and that's essentially what the WHO has said, is that it has not been proven, but because there's no evidence to support that it is for sure okay or for sure one way, that they're recommending to not use NSAIDs for treatment if possible. If you are already on an NSAID or a steroid for other health conditions, do not stop taking that. Obviously, this isn't something that's proven, so it doesn't mean just because you're taking it that you're gonna have illness and it's gonna be really bad. They just have said that there's evidence of some reports coming out that this might enhance the disease, but there is absolutely no definitive information. Again, they're so early on in this that there's no way to know for certain. So that's why the WHO stance is to try to reduce usage of that and use things like acetaminophen, unless you have liver issues that prevent you from using that, obviously. And again, talk to your medical doctor, your physician, if you've prescribed anything. Do not change your current medication or stop taking something for another illness or disease that has an NSAID or anti-inflammatory in it simply because of this information. Just know if you're sick, try Tylenol first. Don't go to NSAIDs if possible. I think that's about it. I'm almost at 15 minutes. I'm trying to keep these short. I'll try to keep rolling them out. Please continue with questions. Thank you guys so much for the feedback. And I'm happy to continue to help and answer questions as they come in. And hopefully I can continue to give you up-to-date information. With that, stay safe, continue to isolate, and wash your hands.